H.R. 371 preempts state consumer protections that are critical to the quality of care and health of the patient. And in addition, this legislation repeals all insurance reforms and patient protections that were included in the Affordable Care Act. I think it's throwing the baby out with the bathwater. I find it aggravating, disappointing, and frustrating that this committee has continuously done nothing but take up legislation that would repeal the Affordable Care Act, punish patients, and put the insurance companies back in control of our health system. I'd like to direct my question to Mr. Larson. Mr. Larson, many states have spent years developing standards for insurance plans that they believe not only provide adequate minimum coverage for beneficiaries, but also make sure that providers will be adequately reimbursed for services rendered. If we allow the purchase of insurance policies across state lines, why wouldn't employers look to purchase insurance on the basis of the least cost to them and not on the basis of whether it will adequately provide coverage or payments to providers? I would call it a race to the bottom. Would you?
I think that's exactly right. You're going to see companies, both the insurers and then the companies, looking for the market that has the thinnest and therefore cheapest coverage. And of course, everyone wants inexpensive coverage until they get sick, and then they want comprehensive coverage. And that's why we've got to get a comprehensive benefit package that's available to everyone, that's still affordable. But when you go down this route, you end up segregating the market, and the young people get peeled off and the healthy people get peeled off. And what you have left in the market is the sicker people who get sicker and more expensive, and you're not solving the problem. The only savings you're getting is from peeling off the healthies.
And that's why we have the individual mandate in the Affordable Health Care Act, because if everybody is insured, then everybody has the good coverage. And you don't cherry pick or, as you say, have a situation where everybody wants to pay a minimum and then wants maximum coverage when they do get sick. You know, when you're 26 or 27, my kids are around that age, you think you're never getting sick. And then suddenly there's an accident or there's whatever, and then you find out that you're sick. And if you're uninsured, where do you go? You go, right to the emergency room, which is the most expensive health care for everybody, and we're all paying for it. Now, a number of states, including my home state of New York, have developed programs that assure that if a given insurer in their state were to go under, that the state would step in and pay the bills, assuring that the affected customers would have access to care and providers are paid. So let me ask you this. As a former insurance commissioner, can you tell me, if we allow interstate purchase of insurance, how would individual states protect their citizens and providers from the insolvency of an insurer?
Yeah, and that with all the talk about healthcare reform, that's one of the critical functions of what states do, is make sure that the companies are there when the claims need to be paid. So solvency regulation is critical, and if you lose your ability to ensure the solvency of companies that are selling policies to people in your state, that's a huge loss.
Thank you. I couldn't agree. Dr. Parente, I saw you shaking, nodding your head, so I was wondering if you had any comment.
No, I agree. I mean, the purpose of what we're talking about in these laws doesn't get rid of insurance commissioners' functions at all. It just sort of lets the insurance commissioners basically be accountable to the lobbyists for the stuff comes in for the individual mandates, and say, do you realize by putting that mandate into place, you have now priced out somebody that otherwise really needs this care from being able to afford it? And basically makes that more of a dynamic economy about understanding the pros and cons of having that lobbying function. It's great to have these protections, but they don't come without cost, because at the end of the day, an actuary will look at anything that you add and put, this will now add cost to it. It's already happened with ACA, even though people didn't think that would happen when it was first developed.
Okay, thank you. Mr. Chairman, I yield back. Thank you.
Chair, thanks to the gentleman. That concludes our questioning. This was an excellent panel. I want to thank all the witnesses and members for their participation.